local health district.
Excellent. All right, Emma, so we've obviously had that positive case stay in Harden over the weekend. What has resulted out of that so far?
So over the week since the exposure in Harden, we sent a mobile testing unit out to Harden. We had a fairly high number of people come forward for testing. That was, I suppose, in response to the large number of casual contacts and the close contacts that were identified through the 3 exposure sites. So of that, we have now processed all of those many hundreds of tests in our lab, and they've all received and returned a negative result. So that's very pleasing for us to have that information. We're out there again today, so out in Harden between 10 and 2, and so we're still asking if anyone is coming, in that they've been in those 3 locations at that time, or that they've got any mild respiratory symptoms to come forward for testing.
Now, one of those exposure sites was a local IGA. I mean, we've had exposure sites through our region, but I think this is the first probably supermarket we've had. Are those sort of exposure sites a bit more worrying for health authorities?
Yes, it is, and that's where we saw the highest number of our contacts that were identified through that IGA exposure. So yes, we do see a larger number of people just because of the higher frequency, but also supermarkets, as you would be aware, are a critical service and an essential service, so people are attending those in lockdown, and that's all a legitimate reason to be out of their home. So naturally we will see a larger number of people.
And I guess we have had the Harden one. We've had a few other exposure sites as well through Hay and up West Wyalong. Have we had anything come out of those, or have they been unscathed as well?
Yeah, they've been unscathed. So again, we applied the same process to our exposures that we had at West Wyalong, Hay, and then round to Tooleybuck. Over the weekend we had Coolac and Henty, where we have our mobile units go out there, but also we surge up at our hospitals as well to take on any testing, and that's a really good strategy. Local communities know where to go, they're familiar with their hospitals, so that testing is really a great strategy to get the testing there quickly. We also have a very well coordinated pathology courier system where we get that courier right there on that day and get that lab working to process those results that night. So our turnaround times are well within 24 to 48 hours. So it's really a really good strategy for the communities to have those back and quickly. And of course it suits, the public health response, because we need to know also very quickly about what those results are.
And
we've had a couple of false positives, Walker and Tamora, also just to the west of it, MLHD and Darranwood. How do you go about trying to keep, testing rates up whenever we get these exposure sites, given we have had a few of those now in the region?
Yeah, so look, testing is something that should be happening outside of all exposure sites, and we encourage communities regularly through a number of platforms and reminders to say, if you are having any respiratory symptoms whatsoever, and we spoke about last week around, a lot of people at this time of year have got hay fever. We're encouraging people, we'll go out with that messaging as well, encouraging people, please don't sit and think that and be complacent around hay fever symptoms. Come forward for testing. We also make sure that testing is easy to access for communities, so it's not a hard exercise. So walk-in testing is a strategy that really does encourage testing, because it does remove some of those barriers to having to book in, register, and all that. So we're removal of barriers, but also making testing available to a number of our, outside the main centres of Wagga and Griffith.
Emma, so with this rapid response that we have, do you think this could be contributing to the fact that our region is relatively unscathed? We're one of only 2 local health districts in the whole state that could potentially come out of lockdown because of our success. Do you have anything that you would attribute that success to, whether it's patients' behaviour or testing, or what would you contribute it to?
I think it's a combination of a number of strategies. Certainly one of them is what you touched on around our rapid response to testing, getting out to these sites and having that ability to stand up testing within hours, which is remarkable to be able to do that, considering the large geographical distances that we've got in our district. We also have rapid turnaround times, so that also, that's also a factor that, really, I suppose, allows us to, respond fairly quickly. But also too, I don't think we can minimise the community's engagement in this as well. So communities have been very proactive in this space, and you only have to look at some of those wonderful LHACs and some of the groups that are working really hard to get their communities testing and vaccination. So there's a number of strategies I think that have worked hand in hand to keep our district safe and continue to do that. And certainly our vaccination clinics across the district, we've got some really good, wonderful reach for vaccinations, not just with Murrumbidgee, but the Primary Health Network and the GP clinics, they have got a lot of options for vaccination as well. So I think, that there's a lot of all of those factors working together that have really contributed to our success so far.
And on that vaccination, I know there's mandatory vaccination for New South Wales health workers now for MLHD workers?
Yeah, there is. So we are required by the 30th of September to have, as a general rule, healthcare workers to have their first dose. And our aged care facilities by the 17th of September. So we're on track to get that vaccination rate. So we're happy with the progress thus far. But we're also working very hard with all of our partners to make sure that we can, provide vaccination across all of the district.
Have you had any uncomfortable situations with some staff who don't think it's fair to have mandatory vaccination, or have most been on board?
No, look, I think the far majority are on board. We certainly have the option for staff who have a genuine medical contraindication, and that's certainly that's in line with the public health order. So if someone does have a medical contraindication, that there is a process for them to follow.
Just to drill on the stats of that, where are the rates up to?
So we haven't got our rates for today, but we've certainly we get a data drop at a certain time each week. So I probably can't give it to you today, but we'll definitely keep you up to date with that.
And have there been staff members who have submitted exemption requests or whatever?
Probably can't comment on that at this point, but I mean, just the sheer numbers, you would expect that there is going to be a percentage of those, but we wouldn't have a specific percentage of those just yet.
For the people who don't want to get a vaccine or don't have a booking or don't have an exemption in processes, what happens to their employment on September the 30th?
So the public health order is really clear that if you are a health worker with New South Wales Health, that you do require vaccination. And the only alternative to that is a medical contraindication. So we're working obviously with all of our staff, on options around that, but also, obviously trying to encourage staff, for vaccination, but also trying to provide options for them if they would like to be vaccinated before the 30th of September. We have lots of priority vaccination appointments for all mandated people who have now been required to comply with that public health order. So we're making it really easy for people to get the vaccination if they are a priority group of people.
How are waiting times going for people outside of the health services? We've heard from at least one person who hasn't been able to get a booking with the New South Wales health system, another first responder who's been registered since May.
Okay.
In Murrumbidgee, so not in Wagga, I'm talking more further afield.
Sure.
Why can't they get vaccinated?
Yeah, look, I think it's fair to say that there are large wait times across the state for vaccination, and we certainly have a wait time in our district. But what I can say to you is that there are mechanisms, and we work very hard with our agencies across the district, so all, like our police and first responders and, all of those groups, to make sure if they are wanting a vaccination, because they are part of that 1A and 1B group, we have a process for them to let us know, and we get them into our priority vaccination spots, which we allocate a certain amount of those each week. So we haven't been, that I'm aware of, we have not been in a situation thus far where we have not been able to allocate someone a priority appointment within the week in those first responder categories. So, that's something that we take very seriously. We do want those people to be vaccinated first and foremost.
I'll follow up with you on a specific example later, but
yeah, sure.
In terms of the rules with vaccinations, it's a bit, you can leave your local government area at the moment. I know you don't make the rules, but I'm just wondering, you can leave your local government area to get a vaccine if you can't get one in your local government area, as long as you go the most direct route. But is there a bit of, say you can get one in a month's time, but you can get one tomorrow outside. Should people just be trying to get a vaccine as soon as they can, wherever they can?
I think, first and foremost, people should comply with the public health order. That's number one. And also be aware, have that situational awareness around what is the risk for them if they did travel outside of their district. So there's lots of there is lots of factors in that sort of response. And I think with the LGA, moving out of an LGA, we know that like in our district, you can go 5 kilometres and you're out of your LGA. So, and that's, for example, we might have a vaccination clinic at Deniliquin, but you need to travel 5 kilometres to get there. So we would encourage people to do that. However, it would just be the personal circumstances of every person, taking into, as I said, consideration of what is the risk for them driving and going out of their LGA versus what is the risk, in getting that vaccine appointment quickly. So it's very individual, I would say.
Just curious, just on vaccinations, Edward River has quite a low rate compared to the rest of the Murrumbidgee local health district. Are there any efforts to try and ramp up testing in that area?
Definitely. So we are very, very cognizant of the LGA vaccination rates. That's something that we use to plan where we go, what we do, and how we do it with vaccination. But we also work with all of our providers. So the GP clinics are a very big part of this puzzle. And out at Deniliquin, I will say for Edward River, there's a GP respiratory clinic that is doing a large amount of vaccines as well. So we work very closely with them to make sure that we're partnering to deliver vaccines. We also have a vaccination clinic out there as well. And we know that there's a lot of outreach that's done from Deniliquin for the vaccinations as well. So yes, overall, we will always look at vaccine rates in how we plan our vaccination.
So is that being done for all areas? And I do is falling a little bit behind as well.
Yeah.
And they're saying there is a shortage of supply there. Is work being done to get other areas supply as well?
Absolutely. So we've met with all of our partners in June just recently, and we're looking to support that area, and there's a few strategies currently underway. And as you probably know, they've got a great GP clinic out there that's really proactive in this vaccine space. So we work with them and with all the stakeholders to try and get vaccines in arms. That's our priority.
And is there any sort of demographics in the vaccination rates that are falling behind, say age-wise? Like, is it older people, younger people?
I think just in general, given the way the vaccine is rolled out, we obviously see higher rates for people who have had the vaccine open to them first and earlier. So in that younger age group, whilst we've only had probably a week with that 16 to 39-year-old group. So we should see those vaccines really pick up those rates in that age group. And look, I can assure you that the appetite for vaccine in that age cohort is very big. On the day that opened up, we had thousands of people register into these clinics, and certainly that's what we're seeing and hearing across all of the vaccine providers and the clinics. They're saying the same, which is really pleasing. Yeah, it's great.
And there is talk of the Riverina potentially being brought out of lockdown because of the low number of cases here. Is that something the MLHD thinks would help, or is it something you guys are a bit worried that then cases will start popping up if we get out of lockdown?
Look, I mean, I don't have any advice around whether we're opening up or not. You're probably just as much as aware of that as I am. But, we'll work with what we've got at the time. And certainly, we've been running this for 18 months now and, worked inside a lockdown and outside a lockdown. So we will do whatever we can and what we need to do if it does open up and respond accordingly. So.
And just going back to Harden, which we were talking about right at the start, do you know the exact number of tests that have been conducted out there since that case?
Yeah, so on the first day that we're out at Harden, there was 235 tests completed, and they were all processed overnight, and we knew yesterday morning that they were all negative, so that was very pleasing to know. We know the next day, so yesterday, we completed 114 tests. So hence why we are going back today, because there's a need out there for more testing, and we know that those 114 tests now are negative. So we will go back today, and hopefully we'll have the same result tomorrow. So we'll be watching those results very carefully.
Just quickly on that Harden one, I know I was talking to the manager of the hotel there, and she said all her staff are in isolation. Do you know if they have to isolate until negative results, or they are close contacts who have to isolate for 14 days regardless?
I don't know about those specific staff, to be fair, to talk to that publicly. But what I can say, if you are a casual contact, the rules are very clear around that you isolate until you have a negative result. However, if you are a close contact, a negative result will not clear you, and you are required to stay in isolation for 14 days regardless. Yep.
On rapid antigen testing on the border,
Yeah.
the member for Farah, Susan Lee, is very keen for that to happen.
Who, sorry?
The member for Farah, Susan Lee,
yes.
really wants that. Is that something that you think would help processes, or given, or would it be logistically hinder efforts?
I think rapid antigen testing, certainly we've spoken about this, and it's coming up quite regularly now in conversations around strategies in terms of prevention and looking at that, particularly in that surveillance testing area. So just one thing to be really clear about, rapid antigen testing is not a replacement for PCR testing. So your swabs that you go and have, so they're two different mechanisms of testing and therefore would not replace one. So look, rapid antigen testing, we have not been advised for the use in health services, so we are not using them. But we're always open to and I will say this is a very agile space and a very quickly evolving space. So, as soon as, of course, that, we're able to look at any other type of testing we do and, respond accordingly. But yeah, just to be clear that rapid antigen testing is not a replacement for our PCR clinical testing.
It also has a higher false positive
Yes.
rate. Does that make it more difficult for your public messaging? Like what I've suggested before about the false positive report.
Yeah, you're right. Yeah, so it definitely is not, and that's why we say it's not a replacement for the stock standard PCR tests for that reason. So we know that the rapid antigen testing, sits around somewhere around that 50 to 60% accuracy. So it's something that you need to obviously use in a very particular circumstance and environment, and clinical settings is, not one that we would use that. However, I do know that there are a lot of other areas using it as part of their surveillance.
And finally, just on the lockdown, I know we're talking hypotheticals here, but we've seen with the people coming through the region, testing positive, exposed sites, they're all over the place in some of our smaller areas. And you've got your mobile testing clinics
Yep.
and that. But is that going to make the job harder because lockdown lift's going to have higher numbers of people who are closer casual contacts? How are you going to go reaching all corners of the LHD?
Yeah.
If that happens?
Well, only 3 weeks ago we were exactly in this situation. So lockdown wasn't around 3 weeks ago, and it hasn't been around for big part of that 18 months. So I think from our perspective at the health district, we're very well equipped to work with any type of environment that presents itself. Yes, it does create a lot more transients. So therefore we need to be obviously testing a bit more and able to deploy quickly as needed. So I'm very confident in the health district's response and how we can do that because we have done that before. So I think it's really just, for us, again, very agile. We just need to respond.
Any thoughts on?
Yep.
Yeah.
Feels
Anything
like
else you
we've
want to
had
say?
more
No.
like exposure sites during lockdown than we've had previous.